Good morning and welcome to our Alaska Collaborative on Health and the Environment teleconference titled How Trump's Proposed Budget Cuts Threaten Clean Air, Clean Water, and Public Health. My name is Diana DeFazio, and on behalf of Alaska Community Action on Toxics, I'll be facilitating today's call. CHE Alaska is a regional partnership group of the National Collaborative on Health and the Environment. CHE Alaska aims to advance knowledge and effective action to address growing concerns about the links between human health and environmental factors. You can find more information at akaction.org and healthandenvironment.org. Today we have three presenters: Dr. Tracey Woodruff of University of California, San Francisco, Dr. Linda McCauley of Emory University, Nell Hodgson Woodruff School of Nursing, and Pamela Miller of Alaska Community Action on Toxics. Our presenters will not be using presentation slides. However, Dr. Woodruff has provided some documents that she will be referencing throughout her talk. Links to those documents were included in the email I sent earlier this morning with the dial-up instructions, and they can also be found on our homepage under the post for today's call. Be sure to click Read More to see the full post, as the links do not appear on our homepage. I also recently added a link to a relevant Washington Post article from earlier this month. As with all of our CHE Alaska teleconferences, we will leave time at the end for discussion and questions from participants. Now it is my pleasure to welcome and introduce our first speaker, Dr. Tracey Woodruff. She has presented on other CHE Alaska calls and has traveled to Alaska as part of ACAT's Breast Cancer Prevention Speaker Series, and we're delighted to have her on this call to share her expertise. Dr. Woodruff is a professor at the University of California, San Francisco School of Medicine in the Department of OB/GYN Reproductive Sciences. Her research program focuses on advancing our understanding of how exposure to environmental chemicals affects early development through an innovative multidisciplinary approach that, one, integrates research on understanding exposures of pregnant women and fetuses to environmental contaminants and the impact of those exposures on health and fetal development, and two, translates these scientific findings to healthcare providers, policymakers, and community groups in order to improve clinical care and promote policies that prevent prenatal exposures to harmful chemicals. She is a former senior scientist and policy advisor at the EPA under the Clinton and Bush administrations. Welcome, Dr. Woodruff. You may go ahead and unmute your line and begin.
All right. Thank you so much for inviting me to participate in this call. And I'm going to be giving, I'm first going to start with a brief overview of some of the critical parts of EPA's mission and why it's relevant to the health and well-being of all the citizens in the United States and really actually probably worldwide. And then I will do some brief overview about some of the things that are at risk or at stake in the current administration, which I think now that we have been into this administration a little over, I guess it's almost 9 months, I think a lot of the patterns about what we can anticipate in terms of effects at EPA have definitely revealed themselves. So first of all, just to ground this discussion, when people think of EPA, they might think of it as, I mean, it's definitely a regulatory agency, but its mission is to protect human health and the environment. And when I talk about EPA, I like to say that EPA is a public health agency at the same level as other public health agencies that people may typically think of as CDC. And in fact, EPA has a lot of power within the federal government because they have a very strict regulatory authorities given to them, granted to them, or given to them under a number of different laws that Congress has passed and previous presidents have signed. So one of the challenges that EPA faces in terms of environmental health is that particularly around chemical production, and which is why there's a lot at stake in this current time during this administration, is that chemical production in the United States has increased dramatically over the last 50 to 60 years, so over 15-fold since roughly the 1940s and 1950s, and chemical use of industrial chemicals is ubiquitous in all our daily lives and all the many different products that we come into contact with every day, whether it's in the food we eat or the water we drink or the air, and certainly within many of the different types of consumer products that we have in our home, both building materials, personal care products that people use every day, cleaning products that people use in their home, and other types of products that they may use, for example, to store their food. And the challenge is that because there's been such a huge growth in industrial chemical production, that it's to the point now where if you look at data that EPA puts out, there is about 30,000 pounds per person. This was data in 2012, and it's about the same in 2015, produced for each person in the United States. So someone here at UCSF recently wrote an editorial that was basically, that's 14 tons per person. So we have a lot of industrial chemicals that are used here, and this is, I think, would be true in other developed countries. And so we're all exposed to these different industrial chemicals, and there are populations who are going to be at higher risk, so pregnant women, children, largely because they may have higher exposures for children because of their developmental stages. They have many different activity patterns, particularly like crawling around on the floor, or because their developmental stage, they're more vulnerable to perturbations that can happen from being exposed to industrial chemicals. And certainly occupational exposures are going to be very important. So workers, because their exposures are going to often be higher than that in the general public. So we also know that everyone is exposed to industrial chemicals because we've had a lot of biomonitoring, particularly starting around the year 2000 activity, and our research and others have demonstrated that children and pregnant women are exposed to dozens of different chemicals, many of them at levels that are associated with adverse health effects, and that we're also seeing concurrent increases in the damaging effects of these pollutants, so increasing diseases in children, including ADHD, autism, certain types of cancer, and obesity and diabetes, give us our sort of compelling focus to look at these external factors that may be influencing child health, particularly industrial chemical use. So just to give some, I would say that the fact that we are measuring these chemicals, that the science shows that they're impacting health, and that we're seeing these increasing chronic diseases has given a lot of impetus for action by different groups or calls by different groups, including a lot of NGOs, but now we're seeing physician groups saying that we need to do something about industrial chemicals and addressing those. And I'll talk a little bit about some of the activity that's been going on with a lot of that activity has been through the recent amendments to the Toxic Substances Control Act. But I would say that there is one area that EPA has been very successful, and is also actually a lot of focus of the current administration's deregulatory activity, which is around air pollution and decreasing the levels of air pollution in the United States. Just to give some context, because I think there's a lot of language floating out there that the environmental regulations, or environmental protections as we like to call them, cost the economy money. That's actually not true. They do cost money, but the dollar benefits of environmental regulations have been shown both by EPA and also by the Office of Management and Budget to far exceed, the monetary benefits far exceed the cost of environmental regulations, and many of those benefits are accrued through the regulations that have happened through the Clean Air Act, and in particular the regulatory standards for the criteria air pollutants, which are PM, particulate matter, ozone, CO2, NO2, SO2, and lead. And EPA, which has been required by Congress to do, has done benefit cost analysis of the Clean Air Act, which has produced, last estimate that I've seen, over $2 trillion in benefits. And we've also reduced the level of criteria air pollutants in the United States certainly since the 90s, while at the same time growing the economy. Vehicle miles traveled have gone up, population has gone up, and so has energy consumption. So actually, environmental regulations do not impact the economy, and sometimes are a win-win because we can improve health. And just to put EPA in the context of the rest of the federal government, is the Office of Management and Budget does a report every year on the benefit and cost of federal regulations across the federal government, and EPA is by far the biggest benefits to compared to any other any other agency in the federal government. So there's a lot to be gained by having EPA being strong and focusing on air pollution. I just want to another thing that just recently came out that EPA does, which they have an America's Children and the Environment report, which tracks trends in children's environmental health, and it's very interesting. People want to go look at it this year because, as I said, they've been showing that air pollution, people's exposure to air pollution has gone down dramatically since the 1990s. So, for example, the number of children that are living in counties that have particulate matter 2.5 above the EPA standard has declined from 52% in 2000 to 9% in 2015. We've also seen declines in ozone as well. And for the first time, we're seeing decreases in childhood asthma. Well, childhood asthma had doubled during up until the 1990s, and then there's been a lot of efforts, particularly around regulating air pollution, and sort of childhood asthma plateaued around 2010. At around almost 10% of children, but we're seeing a decrease in 2015 to about 8.4. So it's not a big decrease, but the fact that we may be seeing a bending of the curve in childhood asthma, and it could be because we've been reducing air pollution in the United States, is really a testament to the importance of regulatory standards. So just to talk about the current state of play at EPA, so last year Congress passed and the President signed amendments to the Toxic Substances Control Act, which is really, I think, an area where we've had a lot of lack of, it's recognized as a big challenge, or lack of sufficient regulatory activity or protections to getting chemicals, bad actor chemicals, or chemicals that are posing a risk to the public off the market. We're right in the middle of implementation of that. The EPA recently put out their guiding rules. They're called the framework rules, but they're essentially the methods that EPA is going to use to prioritize and do the risk assessments for the industrial chemicals, and we can talk a little bit more about what those look like. One of the challenges that is coming into EPA is that the leadership at EPA is slowly being filled with people who have criticized or sued the agency. So the head of EPA, Scott Pruitt, has for many years been suing the agency over a number of regulations in the Clean Air Act. The deputy office director in the office that's going to be regulating toxics and pollution was a previous employee of the American Chemistry Council and is on record of providing comments on behalf of the American Chemistry Council about EPA rulemaking within TSCA, and some of those comments are contradictory to what public health and scientist groups have been sending. And now she is essentially, until they're in control of what's happening there. And their new proposed appointee for the Toxics and Pesticides Office is Mike Dowerson, who has a long record of working with many different types of industry groups on risk assessments, and now he will, if approved by the Senate, be in charge of that office. And in terms of the budget, so the President has proposed a very drastic reduction to EPA. I think it's about a 1/3 reduction to EPA, and so there's sort of two pieces to that. One is that there's workforce reductions, meaning there'll be less employees at EPA. There's already a lot of buyouts going on at EPA, and people are leaving, and so that means that we'll have both less knowledgeable staff about how to address both the science and policy development, and then also there will be less people to meet the mission of EPA, and so things will essentially, they'll only be able to do so many things, and a lot of those things will, of course, be under incredible scrutiny because they have to pass through both the leadership at EPA and then through the Office of Management and Budget, which is run by Michael Mulvahay. I don't think I pronounced his name correctly, but he is the architect of the guiding principle that's now in the federal government of this executive order that is a 2-for-1 regulatory executive order that requires for every regulation that a federal agency put out that to be removed and that the net result be cost neutral, but there's nothing in that executive order about what the benefits of any of these regulations mean. It's only about the costs, and the implementation of this, of course, is going to be very challenging, and a lot of this is likely going to be directed at EPA. So in terms of the budget, the budget really comes out of the House, and the House Appropriations Committee has voted out a bill with a budget. It still has a reduction, about 7% of reduction from the 2017 budget that was this past year. So even though it's not a 30% cut, it's still a pretty big cut. And you have to remember that in the budgeting exercise, you have to increase the budget just to keep up with the cost of essentially cost of living increases. So if you keep a flat budget, that's essentially a cut. So there is a cut. There is expected to reduce a lot of staffing, and I would say that the Office of Research and Development, well, there has been a proposal to reduce them more than the other offices, so like 15% reduction in the Science Research Program technical support. Also but there are some programs that may be increased, so Superfund has been proposed for a slight increase in the budget, and we can talk a little bit more about this. But the end effect is that I think we're already seeing this from, because I know from our own personal experience and grant applications that we'll see less science being funded from EPA, which is important because EPA's, when they fund certain science, they fund certain questions that NIH won't necessarily fund. So they funded a lot of research around air pollution and the health effects of air pollution, which then fold back into the regulatory process and help EPA make better decisions about health impacts, for example, for air pollution. And if we don't have the scientific information to make those decisions, then they'll either make no decisions or bad decisions, which is probably part of the intention of the current administration. So I think I'm at time. Is that right? Just checking in.
I'm sorry, I had to unmute my line, and when I did so, I couldn't hear what you were saying.
I was saying I think I'm probably at time. I'm just checking, Greg, so like 15 or 20 minutes. So just basically a brief, I wanted to give that brief introduction about what the reports of EPA, what's going on, and a flavor of some of the things that are happening, and then I thought we could hear the rest of the speakers and have time for questions.
Yeah, that sounds perfect. So thanks for staying within the time so we do have the time for discussion. And so we do have Dean Linda McCauley on the line. If you actually, I'll go ahead and introduce you and then just press *2 at the end of my introduction, and then we can all hear you. So now I'd like to welcome and introduce Dean Linda McCauley, 6th Dean and Professor at Emory University Nell Hodgson Woodruff School of Nursing. McCauley holds a secondary appointment in the Rollins School of Public Health at Emory University and is internationally recognized for her scholarship in environmental and occupational health. She has devoted much of her distinguished career to identifying culturally appropriate interventions to decrease the impact of environmental and occupational health hazards for workers and young children. In 2016, she secured the largest National Institutes of Health grant in the School of Nursing's history, a $5 million grant from the National Institute of Environmental Health Sciences and the U.S. Environmental Protection Agency to create the Children's Environmental Health Center at Emory. The center, a first of its kind in the Southeast, brings together the expertise of the 4 Emory University units and aims to explore how environmental exposures prior to conception, during prenatal development, and postnatally may affect infant health and development. Welcome, Dean McCauley. You may go ahead and begin. And you are still muted, so I'm wondering if maybe the mute function on your phone is selected. And let's see. I wonder why you're having difficulty unmuting yourself. So *2 is the command.
Can you hear me now?
Yes, I can.
Oh, wait.
Terrific.
I didn't get the message to hit *2. So thank you for inviting me to join this afternoon. I did hear Tracey's remarks and hope that the points that I'm planning to make this afternoon add to the richness of the discussion. I want to spend a little time giving you my perspectives of what's going on with the cutbacks and the leadership, Scott Pruitt's leadership of the EPA. Particularly, I want to talk a little bit about chemical safety and the Lautenberg Act and where we think that is going. And then I want to talk a little bit about something I'm very passionate about, and that's vulnerable women and children and the challenges that I think that we're going to face going forward. And hopefully, I know that some of what I'm going to say is going to add to things that Tracey said. So, you know, it's a very depressing time in terms of looking at what's going on at the federal level on a number of fronts. Scott Pruitt, without a doubt, is the most, if not one of the most, or one of the most, if not the most, industry-friendly leader of the EPA that we've ever witnessed. However, I think it's important to look closely at their messaging because, and this is not just in terms of environmental regulation, but throughout the Trump administration, they're masters at the way they message what their priorities are. And they make very sure that they lead with the things that we value and that we have historically valued. But when we look at how they're implementing our environmental protection laws and the priorities that they have, you can see the distinct differences. So first of all, the Trump budget for EPA science was shocking. To cut the EPA's Office of Science and Technology nearly by half, while cutting 40% of the EPA employees who oversee our environmental regulations is shocking. However, when you talk to them about it, they will say things about the mission is still the same, the priorities are still the same, that they are cutting waste and inefficiency. And so I actually believe, as unfortunate as the two hurricanes have been to the United States in recent weeks, I think we are going to be able to see unfolding in the next month, 2 months, the impact of drastically cutting back human capital that staff our federal agencies. And so one of the things, while I care passionately about environmental protection, from the Trump administration viewpoint, they are cutting FEMA, they're cutting HUD, they're cutting education, and so it is, they're non-discriminatory in their cuts. So let me just say that. And so I think when we watch the recovery from the two hurricanes, Harvey and Irma this weekend, and we see what happens when you actually lack the manpower that you need to implement what the federal government was set up to do, it'll be something as an environmental proponent that we can use to show the danger of cutting the federal workforce, because they truly believe there is bloat at the federal level. And that, whereas we believe, let's take for instance enforcement, we believe that let's look at pesticide regulation and what the EPA does to protect worker health. We believe they have been understaffed for years. We know that they don't have enough manpower on the ground to actually be in areas where individuals and communities are put at risk. But our leaders at the federal level really sincerely believe that it's bloated. And so I think if we look at what's happening with the hurricane recovery, we might get a glimpse of lessons that we can then transfer to what's going to happen if the EPA workforce is drastically cut. Now, that being said, there were people from the get-go who looked at the Trump's proposed slashing of the EPA science programs and realized it was dead on arrival. And in fact, at one of the hearings, people said to Scott Pruitt, for the very first time, you're going to get more money than you asked for. They know that the Trump budget is not serious. So in recent weeks we've seen the House bill, and as Tracey pointed out, it is a cut of $528 million proposed. That's horrible for the EPA, but compared to what Trump wanted, people are kind of and I think the Trump administration know that. If they put something so outrageous out for consideration, it makes a cut of $528 million look good. And they're playing this. They're excellent in their approach here. I think when the Senate, we see the budget projections from the Senate, I think we're going to see even a more generous proposed funding for EPA. It might not have the cuts that the House proposes. And then eventually, with all of the sectors of the federal government, they'll work it out. And as Tracey said, we probably will have some cuts, which are very unfortunate. But even if the money is appropriated to the EPA, Scott Pruitt, Nancy Beck have a lot of power in terms of their ability to spend that money or not to spend that money. And so while the money may be appropriated, they may not actually hire the people that they need or move quickly enough when things happen and use the resources that they have. So I want to say a little bit about kind of the climate in the EPA right now, and I think the non-renewal of so many members of the Scientific Advisory Board is an example of what they do. They didn't renew a substantial member of the board's 3-year appointments. It's normal and expected that the terms are 6 years, and so there was a substantial number who had served 3 years and they just weren't renewed. They're being very, very slow in appointing replacements. And so if a committee, an advisory committee, is cut to its bare bones, then there's no way it can do a robust amount of work. And so this delay in hiring, the delay in appointments, is one way that they can keep the people that are handpicked by Scott Pruitt, and many of whom are huge industry advocates, in control of the situation. And so that's what I think is actually going on in terms of the appointments. They don't seem to care that Many of the appointees in the EPA now have been advocates for industry in the past. And in fact, if you look at what they put forward, they will still say they care about the central mission of EPA, but they will equally put in the importance of making sure that industry can work efficiently and create jobs and spur innovation. And so it is, it's very disturbing what's going on right now. So I want to talk a little bit about the Waltenberg Act and what we've seen in the short period of time that Scott Pruitt has been in charge of the EPA. So one of the things, and they will brag about this, that they did right away is they decreased the backlog of chemicals that they were reviewing, which is a good thing. But a lot of them were removed from the backlog. And what they're doing, they did a very important change to the interpretation of the rule that I think all environmental proponents need to understand. That in reviewing these chemicals, they no longer consider all use of the chemicals, but instead they propose to review the chemicals for the use in which it was designed. And so you can have a chemical that's used in the occupational setting, and they will look at its use in that occupational setting and the risk to the workers, but they don't consider beyond that occupational use and look at how people in communities could be affected by that chemical, by degradation, by release into waters, to landfills. And that is a major departure from the way that the law was initially proposed. And we need to watch it very, very carefully, because what it's doing is decreasing the protection of our communities and the vulnerable people in our communities, including pregnant women and children. When you look at a lot of the transcripts of the testimony that Scott Pruitt has given, you have to search for any reference to vulnerable communities. I actually believe they define vulnerability by the industry vulnerability. You just don't see any discussion about, or certainly any highlighting of the need to protect vulnerable populations. One of the most distressing things they did was to, even though the environmental justice sector of the EPA didn't have a lot of money, it was very important to those of us who've advocated for vulnerable populations for decades. And their argument in defunding that office was that it is disseminated throughout the EPA. Well, that's true. Every sector of the EPA has to look at their work through the lens of protecting vulnerable populations and environmental justice issues. But to take away the one office that was their primary mission, to assess how well the EPA was doing in this area, pretty much tells you or shows you the lack of importance that these leaders hold to vulnerable populations. It's not that they say they don't care, they just don't lead with caring for vulnerable populations. They lead with caring for industry, for reducing regulations, to reducing waste and helping people be more efficient, but you just don't hear that they care too much about vulnerable populations. And I guess it comes back to your one's values and beliefs about vulnerability, that we would live in a wonderful world if everyone believed that protecting the vulnerable was equally important. But in reality, we know that that's not the case. If you look at the debate that's going on about the DACA and the Dreamers, you can tell that different sectors of our population define innocence and vulnerability in very different ways. And that's what scares me about what's being done with the environmental justice. So I think that is about all of my time. One other thing I did want to talk about is a little bit about the waters of the United States and clean water. And some of the most vigorous debate going on right now is a real departure in terms of Obama's belief about the waters of the United States, and that we need to protect all of our waters, not just navigable waters, that all of our water flows in eventually into our rivers and oceans, and we need to care about it from its source and not wait until it is in a large body of water or the ocean. This administration doesn't particularly agree with that. They believe in the state rights to regulate water, and some of the most compelling testimony that I've heard about Scott Pruitt and the direction he's taking the EPA is this assumption that water belongs to states, when in fact we all share our water, and it's not you can't put boundaries around where water flows and where jurisdiction is, and that releasing chemicals into small creeks and streams, you take a flood, you take a hurricane like Harvey, and you begin to see how all our water belongs to everyone. And the people in Houston right now who are bathing in toxic water can see that if you don't protect water from its source, you end up with catastrophes like the aftermath of a hurricane like Harvey, and the very toxic water that people are having to live in, walk in, bathe in sometimes, and certainly, hopefully not having to drink any of that water. So I think that's the major points that I wanted to make this afternoon. I think we're ready to turn it over.
Yes, thank you, Dean McCauley, for sharing your insight and perspectives. I'm sure that people have questions. We do want to hear from Pamela Miller, the Executive Director of Alaska Community Action on Toxics. She'll be giving us some information about how these budget cuts could affect Alaskans if they are approved. So welcome, Pam, and to all of the participants, please just hold your questions until the end, and we hope to have some discussion.
Thank you, Diana. This is Pam, and I'm going to talk just briefly about what's at stake for Alaska, and then what we can do collectively in contacting our senators to hopefully protect EPA's budget so that they can protect public health and the most vulnerable among us. First of all, I'd just like to thank Diana. I'd like to thank everyone who joined the call today from across Alaska and across the country. And thanks especially to Dean McCauley and Dr. Woodruff for sharing their important information. And I just so appreciate it. And I wanted to call everyone's attention, if you haven't seen the information fact sheets that were provided by Dr. Woodruff from the University of California, San Francisco. Please take a look at them. They're just, I think, an incredible resource. So a little bit about what we think is at stake here for Alaska. We are concerned about the President's proposal for drastic cuts to EPA's budget and how this would threaten our drinking water, our clean air, as well as public health. There is a lot at stake. If these cuts are approved, we think that Alaska stands to lose a lot, and especially rural Alaskan communities. So, for example, Dr. McCauley mentioned the proposed cut of the Office of Environmental Justice. This is especially important to rural Alaskan Native communities. Protections for the most vulnerable Alaskans, especially pregnant women and children and people living here in the north in the Arctic that rely on the EPA for protection, for regulatory protection, but also just protection through drinking water programs and sewage treatment. State grants that fund the tribal environmental coordinators in rural Alaska would likely face major cuts. State grants that fund both state and local air quality monitoring. These include the code red alerts that tell families and communities when the air is too dangerous for children, especially with asthma and other respiratory illnesses, and seniors and others with chronic heart conditions to warn them about dangerous air conditions. We think also that the brownfield hazardous waste site program and the cleanup of Superfund will be under threat. And another important thing is that research programs that provide the scientific basis for protecting our air, water, and health, I think, are at risk, as Dr. Woodruff mentioned. So these are some things that I think are especially important for Alaska. And I just also wanted to highlight, and Diana called your attention to it earlier in the call, on September 4th, there was an important article in the Washington Post by Juliet Alperin, and this talked about how EPA provides grants to states as well as tribes throughout the country, especially in Alaska. These are important. These include water quality protection, air quality protection, looking at the science about effects of climate change and air and water quality and chemical exposures. Now these grants are under intense political scrutiny by a Trump nominee in particular to the EPA, who is now the Deputy Associate Administrator, John Conkers, who canceled $2 million in grants to universities and nonprofits. And it turns out that Alaska has come under special scrutiny in apparent retaliation for Senator Murkowski's vote on health care. On the same day as this vote, EPA staffers were instructed to halt all grants to Region 10, that includes Alaska, and then this was narrowed just to Alaska. These are grants to tribes and the Department of Environmental Conservation, totaling about $10 million. And although these restrictions were lifted in a 2-week time period, it seems, I think this is a chilling example of how the political review of grants is happening, and that these decisions are not based on the scientific merit of these grants. So if you have a chance to read that Washington Post article, I would urge you to do so. It's a very, I think, important article. Now, I want to focus on some ways that we can take action, because we all have a role, as we did with health care, in ensuring that EPA is properly funded, that the programs that EPA funds to protect public health are protected. So we have several things happening. One is a sign-on letter. We have now more than 30 Alaska-based organizations and tribes that have signed on to this letter to Senators Murkowski and Sullivan, asking them to protect the EPA budget. We have a petition online, and you can sign this petition and write letters to your senators at akaction.org. And finally, a third way is that next week on Wednesday, September 20th at 6 o'clock at our office, we're having a letter writing party, which should be really fun. We're going to write letters to the editor and just get the word out about how it's important for us all to take action on this very important environmental health and justice issue that has a lot to do with protecting public health, and especially, as Dean McCauley indicated, especially protecting vulnerable populations. So I would urge you to please join us, and you can go online at our website to find out how you can participate in any one of these actions or call our office at 222-7714. But we need all of our voices. It's really going to make a difference, I believe, when this discussion comes up in Congress. So we would really appreciate your help. And I'll stop there. Thank you very much.
Thank you, Pam. Thanks to everyone who's called in today. Now it's our time for questions and comments from listeners. So if you would like to ask a question, please press *2 to unmute your line. Please also state your name and affiliation. And if your question is directed to a speaker in particular, if you could let that speaker know that you're addressing her. Thank you.
Hi, this is Patty, and I just wanted to make one additional comment. It's not a question. Alaskans actually have an incredibly important role to play in making sure that EPA has the funding it needs nationwide. And that is because Senator Murkowski sits on the Senate Appropriations Committee and indeed is the chair of the subcommittee that has the EPA budget in its jurisdiction. So she's already come out and said that she doesn't support the 31% cut, but it's still really important to contact her and let her know what we think and how we support her. And so, you know, lots of times Alaska is sort of left in the dust because we're such a small population, but this time we actually play a critical role. And so it's more important than ever for us to speak up. That's it.
Thank you, Patty, for that addition, and Patty is with Alaska Community Action on Toxics. So again, for those of you listening, press *2 to unmute your line, and when you're done with your question, if you could mute your line again, that would help with background noise.
Yeah, this is Tracey. I wanted to follow up on that because one of the things is that one issue is what is the total amount of money that EPA gets, but the other thing is that if Congress is not, I think Linda said this, if they just say, oh, here's your budget, and they don't direct them on how to spend it, then it leaves the administration to allocate the money in any which way they want to. So it's also really important to be specific about where they should be, that Congress should be as prescriptive as possible about certain programs that they think EPA should be funding to keep it so that they don't defund. And of course, a lot of the things that were mentioned about the research program is one area that has the administration has marked for defunding. But if Congress says, no, we want you to have a research program that is fully funded and we said this amount and you should look at these issues, then EPA will have to do that, or they'll get sued, which is another way to make them do that. So I think it's important to also look at, to make sure that Congress is being prescriptive about where they want them to put the money.
So this is Linda McCauley in response to that question. I couldn't agree more, because I really do believe if you look throughout the federal government right now, this is the tactic that they're doing. In other words, they're not spending money because they're not filling positions. And I think the Appropriations Committee and the final budget needs to be very clear in every way that they can, that it be specifically earmarked to spend the money for, like you said, if it's for the scientific research programs, or if it's for enforcement or whatever, and try to tie their hands as much as possible to a commitment to use that money in meaningful ways.
Thank you. If there are others out there who would like to make a comment or ask a question, a reminder.
This is Michelle Gaither. I'm with
Go ahead.
EPR Seattle. and I really want to read that article, but I can't seem to find the link to it or figure out what to search on.
Okay, so let me go ahead and address that. I added that article after I sent the email this morning. So if you go to our homepage, you'll see an announcement for today's call. To the right, it says Read More. When you click on that, you'll see the full list of resources, and the Washington Post article is the last one listed.
Thank you.
Yes. We have about 5 minutes remaining, so if there are other people out there who would like to participate and make a comment or ask a question, you may do so by pressing *2.
This is Linda McCauley. I just want to say one more thing. I think if you look at what happened with Scott Pruitt and the chlorpyrifos inaction that was taken, the inaction that he chose to take followed immediately after reaching out to Dow Chemical. And so this is going to happen again and again, that when you fill an agency with people whose acquaintances and friends are from industry, they will seek the advice first from the people that they know. And so this makes our need to have our voices, whether it's from our community activists or scientific activists, louder than it's ever been before. And there are friends in Congress who will carry our voices forward for us. Never before has there been a need for us to find our voice more than the need right now.
This is Patty again. That actually leads right into the question I was going to ask, which is there anything we as citizens can do about the way EPA, just as an example, is being stacked with people who are fundamentally antithetically opposed to the mission of their agency?
Yeah, this is Tracey. I have 2 comments on this. The first is, I would say that this is part of a very strategic campaign that the industry has been moving for many years. So if you look at a lot of the things that EPA has done right when they got into office, or Scott Pruitt has done right when he got into office, a lot of it has been based on comments that have been developed by the American Chemistry Council, or recommendations by the American Chemistry Council, other industry groups. So I think that in some ways so they're not going to be, he's not going to necessarily change he's not going to change his mind based on science. He's already clearly demonstrated that he is veering towards working with the regulated industry. But I think it's really important. I mean, Alaska, you have Lisa Murkowski. It's going to be, right now, the only way to really effectively deal with this type of situation is to have oversight in Congress. So having people, and Mike Dowerson is next week. He is the person who's has been nominated to run the Toxics and Pesticide Office. He runs Toxicological Excellence and Risk Assessment, which gets half their money from the industry. The vote on him is going to be, and the hearings on this is going to be very important in terms of sending a message about, should this person be running this office when they have demonstrated in their documented alliances developing risk assessments that are favorable to what the industry wants. The other way that to be effective is going to be legal action. So EPA is going to have a hard time in court with a lot of the changes that have been going on, and also actually the public comment process turns out to be extremely important. So under the TSCA implementation, there's public comment periods open, because by law EPA has to respond to all the comments. If they don't respond to all the comments sufficiently, that provides an actual legal opportunity in court when people go to sue them. So So those are two kind of strategies. And, of course, then the election next year is going to be very important because if there's not if Congress doesn't change, there's not going to be just, again, this oversight. Can't emphasize how much during the Bush administration having a Democratic Congress was critical to having a lot of good oversight on some of the actions that were happening there. And there were some things, positives, that happened because of that.
And this is Pam. I just wanted to add to what Tracey said concerning the nomination of Michael Dowerson to head the Office of Chemical Safety and Pollution Prevention and the hearing next week. We and others on this call are part of a national coalition called Safer Chemicals, Healthy Families, and there is an organized effort to oppose this nomination of Michael Dowerson to head this very important office at EPA. So if those on the call who would like to know more about how to get involved with this, please let us know. I think that is critically important. And concerning legal action, just last week, ACAT, along with a few other groups represented by Earth Justice, filed a lawsuit against EPA for their failure to properly implement the Lautenberg Act. So again, if you'd like more information on that, please let us know. We have to fight back. This is a very critical time, as Dean McCauley pointed out, and Dr. Woodruff. So it's very important to hear all of your voices in this.
You know, one of the most beautiful things about environmental justice is the empowering communities to find their voice, and I've been such a proponent of that. If I had criticism of community-based advocacy, is that we still need to be focused on our communities and the injustice in our own communities, but never before is there a greater need for individual communities to join coalitions of communities. Because as long as we stay focused on our community, and that's why I talked about hurricanes to people from Alaska. I know you don't get hurricanes in Alaska, but it's very, very important to watch what is going on in those impacted communities and use them to advocate for collectively for all vulnerable communities. It's critically important because it really helps the opposition if we stay focused on our own local communities at this point in time. And so I would ask each of you, what coalitions do you belong to? Are there other coalitions that you need to join? Can you talk to your community in Alaska about the other groups across the United States that are critically important, critically needing your help and your advocacy? And eventually, the community voices will drown out the industry voices if we do this right.
Thank you, Dean McCauley, and I think that's an excellent note to end on for our call today, because as we are out of time, I did just want to ask if either of our other speakers would like to add anything before I make a few closing remarks.
No, thank you for hosting the call. Engagement is so important, and that's what's going to make a difference in making sure that we don't have these, trying to mitigate the rollbacks that are happening right now to public health.
You're here. Nothing to add.
Okay, wonderful. If you do have additional questions, if any of our participants do, or comments, please contact us. Our phone number is 907-222-7714. You can also email me at diana@akaction.org, and I'll make sure that your message gets to the appropriate person. Again, I want to thank all of you for participating today and encourage you to make a contribution to Alaska Community Action on Toxics. Your donation of just $10 or $20 or more will help provide the support we need to keep bringing these calls to you each and every month. And donations can be made online at akaction.org. And so with that, I'd like to thank everyone and have a wonderful day. Thanks so much for participating.